here in Minnesota. So Anna, I'll turn to you.
Thank you, Governor. As the Governor said, we'll start today's roundtable with introductions. I'm Anna Ashby. I'm the Acting Assistant Commissioner of the Health Subcabinet, which coordinates Minnesota's health resources and expertise across state government. Our panelists today are Grace Arnold, the Commissioner of the Minnesota Department of Commerce, Libby Collum, CEO of MNsure, State Senator Dr. Elise Mann, State Representative and Co-Chair of the Health, Finance, and Policy Committee, Robert Bierman, Cindy Vanderpool, who is the owner of Pastures of Plenty Farm and a member of the Minnesota Farmers Union, and Janae Bates, Co-Executive Director at Isaiah. Let's begin with a question for the Commissioner. Commissioner Arnold, could you start by explaining what we're seeing in the health insurance market for 2026 and how this new federal law, H.R. 1, is a primary cause?
Absolutely. So right now, thousands of Minnesotans who buy their own insurance are facing a major hit from the federal government because additional tax credits that were in existence are going to expire. That's support that many families depend on just to afford their monthly premiums. Instead of extending those tax credits, President Trump and the Republican-led Congress pushed through a bill that pulls the rug out for all those Minnesotans. It's a step backward on both affordability and access. It's raising costs, it's reducing the value of the plan that you get, and it's making it harder to stay in coverage or to get into coverage to begin with. And we've already seen the fallout. Insurers are proposing the biggest rate hike since 2017. As the governor said, there's an average increase of over 16% in the individual market and nearly 13% in the small group market. So middle-class Minnesotans like farmers, small business owners, and early retirees will be hit the hardest. On top of that, we have looming cuts to Medicaid that are creating even more instability and uncertainty in the market. Insurance companies are assuming that fewer healthy people will stay in the market, and they're pricing accordingly. This is real. It means that Minnesotans will be forced to choose between paying for health insurance or covering essentials like groceries, rent, or childcare. In Minnesota, we stepped up, as the governor said. We extended our reinsurance program to keep premiums from skyrocketing even further. It's a bipartisan solution, and it works. And without that, premiums would have been 25% higher. But make no mistake, reinsurance is only part of the solution. Minnesota taxpayers shouldn't have to cover for a broken federal government. It's time for Washington to act. They should restore the enhanced premium tax credits, protect Medicaid, and reduce red tape that's going to make it harder to get and keep coverage.
The next question is for CEO Cullum. As the head of MNsure, you're on the front lines of this. So how will the expiration of the enhanced APTCs impact enrollment and affordability for people purchasing coverage on the marketplace?
Thanks, Anna, and thanks, Governor, for this really important conversation. So MNsure helps hundreds of thousands of Minnesotans get coverage every year. These are folks from all walks of life, from all parts of the state. We help families and individuals, and as the Commissioner said, these folks are entrepreneurs, small business owners, farmers, gig workers, anyone who doesn't get their health insurance through their employer. Today, more than half of MNsure enrollees receive federal financial help that lowers their health insurance costs. This help comes in the form of these premium tax credits, which work like an instant discount to reduce the cost of monthly premiums for eligible households. The enhanced tax credits have supported record enrollments through MNsure and an historic uninsured rate in our state. It's within Congress's power to keep these enhanced premium tax credits in place, but if they don't extend them, and soon, MNsure estimates that nearly 90,000 Minnesotans will see an increase on their monthly premium bill, and over 19,000 will lose access to all financial help in 2026. On average, consumers who get tax credits today are looking at a cost increase of about $180 per month, which works out to be about over $2,000 annually. That's a 54% increase in the net premium they pay. And costs for folks who are over 55 and people in greater Minnesota will be hit particularly hard. Let's take a couple in their early 60s who live in Mankato. They have an annual income of $89,000 combined and are enrolled in a bronze plan. Unless Congress acts, this family will lose all access to financial help next year. Their income puts them over the threshold, and they will no longer qualify for tax credits. Their monthly premium could jump from under $500 per month to nearly $2,000 per month in 2026, more than 4 times what they're paying right now, just with this one federal policy change. Think about that. They would be paying nearly $24,000 per year just to get in the door with their health insurance. That's not their deductible, that's not the copay that they would use when they actually go to use their coverage. That's the cost burden they'll have to bear just to keep their health insurance. But even for younger folks in the metro area, cost hikes closer to the statewide average will mean challenges for these folks. Consider a family of 3 right here in Ramsey County. With 2 working parents making $112,000 per year together, their combined salaries put them over that threshold for financial help, and they will lose all access to their tax credits next year. Their monthly premium will increase by about $170 per month. That's $2,000 annually. Again, just from this one policy change. Most families don't have thousands of extra dollars just lying around. When costs rise, families are forced to make tough choices. Is it groceries or gas, rent or medicine? They have to juggle priorities and stretch every single dollar. The damage doesn't stop there. Additional federal policy changes from the Trump administration will restrict eligibility, reduce benefits, and impose new red tape for consumers. We know Minnesotans recognize the importance of having health insurance coverage, but these changes could mean that insurance for many working families will suddenly be out of reach. Regardless of what the federal government decides, MNsure will be here to help Minnesotans try to find a plan that works for their health needs and their family budgets. But we're very concerned that these federal policy choices will have negative impacts, not just for Minnesotans' personal health, but also for wider reaching consequences across our healthcare system and our economy.
Thank you. Senator Mann and Representative Bierman, this federal law seems to directly contradict the work we've done in Minnesota to make healthcare more affordable. What specific provisions in H.R. 1 will have the most damaging effects on Minnesotans and the state's healthcare system?
Yeah, so I think, again, talking about the enhanced premium tax credits, so we expanded that around COVID. I'm just going to recap a little bit, to make sure that no one was paying more than 8.5% of their income on health insurance. These tax credits have led to an increased access to health insurance and historically low uninsured levels in our state. As long as the insurance plan is available to you was over that 8.5%, these credits would kick in to make sure that you did not have to pay more than that. So the goal of it was to make sure that insurance was affordable to everybody. Ending this credit will make it so that people making that 100 to 400% of the federal poverty level will have to pay more, again impacting about 90,000 Minnesotans, 20 million Americans across the country, and those making more than that 400, which sounds like a lot, 400% of the federal poverty line level. It's not. It's about $60,000 per year. It's not a lot. Those people are going to be on the hook for the entire bill. They will lose access to any help from the government. So again, this is a 27-year-old making $35,000. They're going to see their premiums go up by $1,500. At 49-year-old couple making $90,000 with a kid will see their premiums go up by $3,000. Those making above that 400% federal poverty level, again, on the hook for the entire thing. If you are a couple making 70 grand with a kid, you're not going to make that you're going to be, like 85,000 above that level. You're going to lose access to everything. Your premiums are going to go from about $7,000 to over $20,000 per year. Again, this is not affordable. So what we're going to do is we're going to price people out of health care. And what's going to happen to the pool of people that still have the health care, these are going to be the most high-need people. So the price of insurance, regardless of the tax credits, are going to increase because the need will be greater. So these people are going to then get hit twice. One, by losing their credit, and two, by having the price of insurance go up. And as we've heard, 17% increase because of that. We are talking about people not old enough to qualify for Medicare. We are talking about farmers. We are talking about self-employed individuals and entrepreneurs. We are talking about small business owners who are going to be impacted significantly by this, and it's going to be devastating for them. This goes directly against everything we did as a state to bring down the cost of insurance, providing reinsurance to bring down the cost of premium, establishing a single state pharmacy benefit manager to keep the prices of pharmaceuticals low, making sure that insurance actually covers the care that you need. We worked a lot on that this past few years. And this bill coming from Congress is going to undo all of the work that we have done in Minnesota to make sure that people can afford their health care. And this is on top of the millions of people who are getting kicked off Medicaid. And so, as a physician, I am incredibly, incredibly disheartened. I am very worried about what's going to happen to our patients, to the health of the people in America, and certainly in Minnesota, and what this is going to do to our clinics and our hospitals. And I will let Representative Bierman talk more about that.
Thank you, Dr. Mann. Thank you, Governor, for convening this. Thank you for being here to hear about this. This is an issue that is complex, and there are ripple effects, as you're hearing already, from just this insurance aspect. When people forego health insurance because of cost, ultimately, when they need medical care, they will end up at the ER of our hospitals. And H.R. 1 makes all of this worse. More fiscal challenges for hospitals, including the loss of Medicaid patients, and the revenue will lead to service cuts, which we've seen already. I just read about a story in Virginia where they said that they were closing clinics because of the H.R. 1. And we have seen clinics closing in the state previously, but this is going to make it all worse. This compounds the problems that hospitals are facing in their revenue shortage and leading to less accessible care, regardless of insurance, when it's unobtainable. So the fact is, more hospitals could close in Minnesota. We have a large number of critical access hospitals in the state, 76. When I speak to hospital CEOs, this is the major concern now for them. And rural areas are especially prone to the loss of medical care and treatment. So, as was mentioned, we've done our part at the state level. Hospital stabilization was a critical component we worked on all session long, and now we're seeing that this issue could be compounded by H.R. 1. So it is truly, truly astounding to me that at a moment when policymakers know that the American health system across this country needs an infusion of support, the Trump administration chooses to divest resources and add additional costly burdens to states, to counties, to providers. It's the largest cut in Medicaid history, and at a time when the need is greater than ever before. I was out yesterday meeting folks with the counties. I was out meeting a provider on mental health for the youngest children, and this topic was first and foremost one of the things that was most of concern. So hospitals, especially rural hospitals, long-term care facilities, will all feel these effects. But it's estimated the cumulative effect of this bill will cost the state $1 billion a year, and the bill gets worse, as was mentioned, in the out years. So these delays on and loss of insurance, delays on payment, or no payments to hospitals is just going to compound all of this. The important thing to know and to communicate is that we all pay for this. Higher premiums, higher property taxes, and simply higher patient costs for the medical care we all need. And one other thing I discovered recently is the Medicaid funding is being altered in the funds flow arrangement, which will impact our medical education in the state, which is critical for future generations. We need to consider all of these things and urge our representatives in the state delegation, the Republicans who supported this bill, to make changes, support changes and amendments this fall, because this cannot stand. Thank you.
Cindy, could you talk specifically about how these changes will affect Minnesota's farmers?
Thank you.
Our farm, finding affordable health care coverage has been a real roller coaster for a long time. In 2021, I was diagnosed with breast cancer and underwent 33 rounds of radiation treatment. Thankfully, our income was low enough at that time that we were covered by Minnesota Care. It was a godsend for us. I had nearly $200,000 in medical bills. And thanks to Minnesota Care, those were all covered. And it probably saved our farm. I'm now cancer-free, but last year our income was too high. And we went without insurance. And we just saved up to pay all my medical bills, because I still go every 6 months for checkups for my breast cancer, to pay my medications. This year, it did work for us to buy insurance through the buy-in program. It costs about $1,400 a month for us. We are still praying that I don't get sick again, because our plan has a $30,000 deductible. It's a huge source of stress, and I know I'm not alone in this. Farmers and others who don't have coverage through employers are always having to think about health care and how they're going to afford it. The step to increase the rates is going to add a significant financial pressure facing us farmers and others who are struggling right now. This additional pressure couldn't come at a worse time for farmers or just people in general. Our members were in Washington, D.C. lately, and the National Farmers Union put out some national numbers. Farm bankruptcies are up 95%. Since 2022, corn prices are down 50%, soybean prices are down 40%, and those numbers don't look good and are not improving, particularly because of the soybeans and the trade war that continues to put pressure on those markets. While prices are down, farmers' input costs have risen 50% over the past decade. For our farm, we lost the potential for a significant new opportunity in our markets. We were hoping to sell our products to area schools, but because of the cancellation of the USD funding for Farm to School program, that is gone. I'm worried that many farmers are focused on the markets and our opportunities going into harvest. Steep increases in healthcare costs are going to come as an unwelcome surprise. I'm concerned with eliminating the financial protection of the clawback for advanced premium tax credit. As farmers, our income is highly vulnerable, and so that's the top concern. We're not often we don't always know what our income's gonna be every year, and so it's out of our control. The other thing that is hard is that they got rid of the automatic enrollment. It's a hard time when those enrollments come around. It's during spring and fall, and we're busy trying to plant our fields or harvest our fields, and we're focusing on our farm work, not on our insurance. And at our farm, we're all employees. We don't have employees, we're all the workers. We don't have anybody to do that work for us. Yeah.
Thank you so much for sharing your story.
Yep.
Janae, I want to talk about the changes to the private insurance market and how they're not happening in a vacuum. How will Medicaid cuts and other changes in HR 1 fall hardest on Minnesota's most vulnerable communities?
Yes, thank you all for having me. Thank you, Cindy, for telling your story. And Cindy's story is not an unusual one. So I get to work with Minnesotans across the state, Minnesotans in rural places, Minnesotans in the Twin Cities, suburbs and exurbs, and the stories are real. that what Cindy has experienced, Minnesotans across the board are experiencing, and they're experiencing it now. So to be clear, healthcare has been unaffordable for a very long time, and Minnesota has been fighting hard to make it more and more affordable and for Minnesotans to have quality care. But what we are finding is that when horrific things like what is happening at the federal level take place, when H.R. 1 passes in the way that it did, it has decimated our ability to care for one another. And so I have a few stories that I think are important to lift up, but I want to be clear that they are not just anecdotal. It is truly what is happening to Minnesotans across the board. We have a leader of ours named Dave Larson, who is out in Concord, Minnesota, and he was on the exchange for several years, and just 1 year short of qualifying for Medicare because of his age, he had a heart event. And unfortunately, in places that are in rural Minnesota, often they don't have urgent cares. And so he did not have an urgent care. He went to the emergency room. But the level that he was able to purchase his insurance did not cover emergency room care. So because of that, he had to pay $12,000 out of pocket for getting tests. $12,000. And he has had to cut off a bunch of things that he would need in order to be able to pay that $12,000. This is untenable. We are finding that many people already can't afford the higher tier levels through the market and through the exchange, and so they're already buying lower levels. With what is happening with H.R. 1, it will force those rare few who are able to buy maybe a silver or gold tier to have to buy bronze, and those who are on bronze will not be able to afford it, and they will be out of care. And so some of them are doing it, taking a gamble that they will be healthy enough to sustain without having health care. But we have a leader who in Northfield is a furniture builder, and he did that. He went off of it because he could not afford even the bronze level, and then had a catastrophic event and had to pay out of pocket $25,000 for a knee surgery. Again, these are the choices that Minnesotans are having to make. We have a leader in Northfield who is a lawyer, and he was also on the exchange, is still on the exchange, but his kid got very, very ill. And so his family had to pay astronomical amount of money in order to care for their kid, because what parent wouldn't? But that also meant that they couldn't afford the dental level for their own care. And so he went without a dentist for quite a while, ignoring some pretty big problems that were coming up, and now has had to lose 3 teeth. Again, this is the stuff that Minnesotans are facing across race, across class, across place, and it is unacceptable. And so what we have found with H.R. 1 is the devastating impact of what is happening with what it's going to mean for Minnesotans to not be able to afford their care, the devastating impact of what will happen with the cuts to Medicaid. We should be completely clear that people will die. Y'all see me with a collar. I do not believe in hyperbole for the sake of it. I don't believe in fear-mongering, but I do think it's really important that we are clear about what is happening in our state and in our country, and that we don't have to just sit back and be spectators of our suffering. We should push every single person possible to make sure that we are caring for our people and caring for ourselves. We can't just say, oh, it's just Medicaid recipients, it's just those who are on MNsure or Minnesota Care. It is going to be all of us. We've already heard the ways in which this will impact even our employer-based insurance for those who think we're safe. Our insurance across the board will go up, and people who are healthy will think, okay, maybe I'll just wait it out. That's what we're hearing people saying already. Maybe I'll be healthy enough to be resilient enough to survive until. Let's not wait until happens. Thank you.
Thank you all for your comments today. That concludes our formal questions. I'll hand it back to the governor to close.
Yeah, well, thank you all. Cindy, thank you for sharing and trusting us with your personal stories, and Janae for sharing those. Look, this is simply the situation as it lays. This is going to happen. It's not because of market fluctuations, although those always happen. This was a deliberate choice in the federal government. This is nothing new. I think it's almost a direct quote. In 2015, Donald Trump said, "Healthcare is easy. No one knows more about it than him, and he would fix it on day one." This is not debatable, and you need to write both sides of this. He was wrong. He does not know. And there's a reason that the 4 GOP reps who voted for this have not held a single town hall and brought experts there, because you're not going to find anybody from a hospital come sit with you. You're not going to find anybody in the insurance industry say that this is going to reduce costs. You're not going to find any small farmers that are say, you know what I really enjoy? My health care costs spiking or not being able to get health care. Those people don't exist because this is real. This isn't some culture war thing that might not actually happen. This is going to happen. It is happening. And it's absolutely unnecessary. None of it was done. If it was to reduce the national debt, it did not do that. The national debt was driven up. And so we're going to see in Minnesota that this undermines the basic health and security of folks, but it undermines our economic growth because these costs are going to get passed on too. We're going to see employers start to experience this. So I would just say our purpose of this is to try and explain to Minnesotans, and any of us are more than happy if you think there was a good thing that came out of this. If there's some good policies of people dropping off health care and getting more expensive and hospitals closing, if that was your goal, you are achieving that. So tell us why that was a positive thing. But I've not heard that. I've not heard a single thing about this. We've not had people be able to stand in front of their representatives and ask them why this is happening. And we'll take some questions, but I would just remind folks, when it comes to health decisions, listen to your doctors. Don't listen to the politicians. And I feel the need to say this. Minnesota protects your right for you and your doctor to make choices around your vaccines, which are available across Minnesota no matter what policy was brought up. I will note, as governor and as a parent and as a teacher of someone who's in there, the outrageous and totally reckless press conference blaming acetaminophen for autism is without any scientific merit, with any backing. It is going to cause incredible problems and doesn't get at the heart of anything, if I might say. And again, don't listen to me, listen to your doctor on this, but I feel as a public service announcement, as the president yesterday said, that there was no need for newborns to have a hepatitis B vaccine because it's a sexually transmitted disease and they can't get it. He is wrong, of course, as always. Children do get it. Newborns get it passed on from the mother, and they get it in breastfeeding. So I think they maybe tabled that suggestion, but the president was pushing it again last night. We lived through this in COVID with all the false information and the denials. So a combination of an assault on the healthcare system, a contraction of our rural hospitals, and blatantly false information around really important family issues once again shows that this administration is not serious about health care. We in Minnesota are, and I think Rep. Bierman and Senator Mann both highlighted this. This has been a shining bright spot of bipartisanship in Minnesota in many cases of trying to bring down these costs. So I need the folks here to speak up, and they know that this House Bill 1 is a disaster. So any of us will take some questions.
Governor, the premium tax credits has been a huge issue in Congress the last several days. Would you support congressional Democrats forcing a shutdown of that issue?
I would, look, first and foremost, the Republican Party owns all three areas of this. It's their responsibility to pass a budget. What I would say is do not pass a budget that does not fix these egregious errors that are going to hurt Minnesotans. And it shouldn't come to a shutdown. What it should be is Republicans to say, we were wrong, this is bad policy, we take your changes and incorporate it into our bill, and at that point in time, Democrats will vote for it and it will pass on time. So this is a false narrative and a false choice. This isn't about Democrats shutting down government. This is about Republicans' inability to govern and hurting the American public.
If these tax credits do expire, is there a timeline for how quickly we see impacts, how we see them right away, that sort of thing?
Yeah, thanks for the question, Libby Collin-Minsher. So the tax credits are in place through the end, these enhanced tax credits, I should say, are in place until the end of this calendar year of 2025. Starting January 1st, people will be paying more for their health insurance. What is also true, though, is they'll start seeing the sticker shock of the higher prices as soon as October, because once rates come out, then MNsure, we put all of our data into our system. Folks can come in, shop and compare plans. They'll get notices from us about what their tax credit is estimated to be next year. And right now, we're gonna have to leave off the enhanced tax credits. So when we're talking about the folks who are gonna see that and feel that, those 19,000 folks who are currently enrolled in our marketplace are gonna lose all access to financial help. They will see a $0 when they see their tax credit. And the folks who are lucky enough to maintain some tax credit will see a lower tax credit because the tax credit will not be as generous.
Is the system flexible enough that if those credits are restored, you'll be able to kind of correspond and lower those premiums?
It is a really good question. So the short answer is we're going to do everything we can to reduce confusion and to make sure that Minnesotans know what their options are going to be for calendar year 2026. We are so late in this process that I do fear there's going to be confusion if they do choose to extend them. But again, we are able to kind of, we're able to make technical changes pretty quick. We're able to get notices out, things like that, and sort of reverse course. But we're days away from rate release. As soon as rate release happens, there's a whole host of things that MNsure does to get ready for open enrollment, which starts November 1st. So we're really short on time here to keep it from getting confusing.
Who does it call? Do you have any guarantee or assurance from the providers that, yeah, we get those?
The health insurance companies will be able to implement the tax credits, no problem, on January 1st.
I would just say on that one is, this is, again, it's a great question, and it's what we deal with on numerous issues, numerous times a day. There's no thought of this from the administration on what the impact is, both to us, because again, Rep. Bierman pointed this out, this is gonna then, once we make these decisions, go down to the county level, and the county's having to deal with these things. This takes time. Most people plan ahead and do these things. This administration switches on a whim. So I appreciate this, I appreciate the professionalism of this, but once again, all the rest of us are left holding the bags for their incompetency. We'll do the best we can, but I want to let Minnesotans know, just like we can't backfill everything, I can't guarantee you that that will not cause some of the problems as it comes in, depending on when they decide.
I think I mentioned what I just read late last night about some Virginia clinics, and the administrators cited HR 1 as being the cause for them. As this moves forward, as I mentioned, hospitals, some especially rural areas, but also HCMC, have very high volumes of Medicaid patients. So they count on those revenues. When those go away and people still show up in their ERs, they need to cover that expense and cost, and that drives expenses to the rest of the public.
I think my confusion was more that I thought the Medicaid cuts were being implemented in the future.
So that would start in next year. So it's coming awfully quick, and they're thinking about that. But when those other hospitals are making their own financial decisions, yeah.
This was so important, and the way they do, we all know why they're implementing these after the midterm elections, because they're hugely unpopular, and you're hearing it now. And I would just say to the press, I encourage you to fact check every single statistics that have been given you today, every single incident how this is, verify it with hospitals and insurance companies. What you're going to find is it's not opinion. They'd like to try and muddy the water on this. What we're already seeing is those hospitals can't wait till January of 2027, and they're seeing it. But I will tell you, what's happened to this country is a chilling effect of people are fearful there will be retribution if they speak up and say these cuts are going to happen. Every hospital I talk to is already thinking about what it will mean when these things come, because they're going to be responsible for payroll come January 1st, 2027. That's the part here that's, I think, very frustrating to me, that I think these hospitals are making those decisions already because they know it's coming.
May I just add, also yesterday I was at a facility that treats children for mental health. 0 to 4-year-olds, getting them ready for schools. This issue, they have a lot of Medicaid people that rely on that funding, and they're worried about the number of people that may lose that coverage with the burdensome administration. and that's going to affect their operation, and they're treating thousands of kids. So, I mean, this has a ripple effect and costs. So it's well beyond just hospitals, too.
Representative Spearman or Senator McMahon, do you guys have any information on how the repeal of coverage under Minnesota care for undocumented immigrants could be compounding this issue at all?
Clearly, without a place to go for preventative care or treatment at a clinic, which would be a lower cost operation, maybe $150 to go into a clinic. Instead, people who are undocumented can still resort to an emergency room, and hospitals need to treat them to make them stable. And now you're talking about a $5,000 bill instead. So I can't extrapolate on what that cost is in the system, but it is there, and it's one reason
Yeah.
we're concerned.
I'll also add that, you know, Republicans came to us last year and said this is the one thing we want, is to take away health care from these people. And so that was something that had to be done, or else we were going to not proceed with our budget. However, what we did in turn then was we funded our federally qualified health service clinics to make sure that everybody in Minnesota could still get access to a clinic and to access to care. Now, what's happening if you take away, on top of that, Medicaid and increase the premiums, we're pricing people out of health insurance, is that those clinics are going to be completely overwhelmed despite all the funding that we put into them, and we're going to see increased wait times in the hospital ERs and in urgent cares. We're going to see our hospitals become overcrowded again, just like we did in COVID. This is going to be an absolute disaster for our healthcare system.
I just wanted to clarify, so last year you had no insurance and saved them. This year you had bare bones insurance with a $30,000 deductible, hope you never had to use it. What's coming next year? I mean, do you have any sense? Anyone run some numbers for you here?
I honestly have no clue. You know, we just take it day by day. With farming, you know, being we direct market everything that we sell off our farm, as far as our livestock goes, we don't know what people's income is going to be, if they're going to be willing to buy from us and support a Minnesota-grown farm, or buy something cheaper that they can find at a discount store or something. And so our income is very unpredictable. We don't have a salary that we get every year. Our income is reliable on what we sell. And so we basically take home a very minimal, you know, amount of money from our farm every month just to cover living expenses. And, you know, sometimes that works and sometimes it doesn't.
Yeah, no, we just had Farm Aid this weekend because the last time we've seen a crisis in farm country of this magnitude was 1986. So the double hit that's coming to these families is massive. And I would like to note too that it took us years to develop these markets. These contracts that are being signed with Brazil, when Chinese are searching elsewhere, those are 10-year contracts. So it's not magically we're going to, you know, cut a deal because I'm super dealer in the White House or whatever. Those are not coming back. So the income's not going to increase. At the same time, the healthcare costs are going up. At the same time, your local hospital's struggling to stay open. At the same time, they're cutting education funding. So for rural America, the perfect storm is upon us. And in Minnesota, I'm grateful to the legislature continues to try and work on that, but they clearly made the case why this is bad policy. And I once again say, this is not some culture war, you know, who's using your bathroom. This is just simply factual, and it's what's in the bill, and it's how we have to deal with it. And I think it's important that Minnesotans get prepared. We try and figure out how to best combat this, because we know that when people get health insurance and they're able to get the preventative care, that our economy grows, our communities are safer, families are better off. So we're grateful you're all here. I would be glad to take some off topic if there's any and let these folks go, unless you have one more on. Sure, you got a couple ons, that's fine.
Commissioner Arnold, hi, it's Erica Zerk from Journey News, and I'm curious, beyond the reinsurance program, is there anything that the state can do or is looking to doing to continue to try to
Sure. Yeah. So thanks for the question. You know, we've done a lot of work to make healthcare simpler and as affordable as possible. So I think that Senator Mann mentioned the statewide PBM. We do a good job of looking to make sure the rates are what we call actuarially justified, but to make sure that the insurance companies really do need to charge the rates. We've made it healthcare simpler and lowered copays on a lot of prescription drugs. We've made it easier to access primary care through your coverage that you get on MNsure and in the small group market. That's really important for all the things that we've said. Like I use the example of my son had a weird rash. Every parent has had that happen, right? I took him in. He got antibiotics. If he hadn't, our doctor said they've been seeing a big increase in staph infections. If you don't go in and get that primary care, you end up with a huge bill later. That's a big problem, and we've talked about how that goes into the system. But those are the kinds of things that are kind of simple, and you know, I think we probably don't talk about them enough to make the way people get their care and, you know, to the extent we can, the rates that they're paying as low as possible. It doesn't help when the federal government is making it as hard as possible.
Could I ask how the Rural Health Transformation Fund factors into all of this? And I also wanted to ask Cindy if you had any thoughts from farmers' perspective on how that should be distributed.
I'll just say that I think, as the governor mentioned, we are being handed an issue in all of our health insurance marketplaces that is going to be really challenging for the state to fix. That said, I think we are putting every effort forward to put forward a really solid application that supports rural Minnesotans and hope to receive approval from the federal government for those funds.
Look, we're looking forward to those funds, but let's realize this was an afterthought if they realized the blowback they got because of the impact to rural, so they put these funds in there. And I just have to be candid with you on this as I speak to governors across the country. I'm concerned that states led by Democratic governors are having a harder time accessing the money. And I'm just going to, at this point, we'll see if that pans out, but it sure certainly feels that way to me. Because the issue is once they pass this, the blowback that came from red states that are even more dependent on the federal government for this was immense. So they said, we're going to create this pot of money. Our team's doing a great job to follow the rules and access that, but I'm worried. I'm worried they will simply deny states and then try and say, well, we had money in there and you weren't able to get it, even though we rank as the top state for health care, some of the best delivery. So, Eric, you had a question?
Yeah, one for Senator Mann. Wondering if the votes aren't there now, obviously, but is this for a drive interest in single payer?
Yeah, I don't think there's ever been, I mean, from my perspective, a decline in the need for single payer or the want for single payer. We have spent the last decades in this country trying to decrease the cost of healthcare by making it less accessible, right? We've inserted networks, we've inserted prior authorizations. So to keep healthcare cheaper, we've made it so that people can't access it. And in turn, we have prevented preventative care and clinic visits, which leads to more expensive care. And so over the past decades, despite keeping people from getting healthcare, the costs have continued to increase. And so I think we are at a point where we have to have a serious conversation about why are we the only country left without universal health care? Why are we the only country left that people go into extraordinary bankruptcy and debt because they needed to access health care? Health care is something every single human on the planet needs. And so we need to have serious conversations about how to get that for people here.
That's a perfect stop point. And a TED talk, I might add. Thank you to the panels. I'll take some autopsies if you have them when they're done.
We'll let panels come over.
Let them clear out.
Sign the cameras.
Thank you all.